Welcome to our deep dive into the world of surgery and diagnosis. We're going to be looking at Atul Gawande's Complications, a book where he kind of pulls back the curtain on what really happens in medicine.
Yeah, it's a fascinating read. Gawande doesn't shy away from the tough questions. He explores how doctors learn how the system itself can contribute to errors. And how even with the best intentions, things don't always go as planned.
One of the things that really struck me was his own experience as a surgical resident. He describes this intense learning curve where he's basically learning on the job with real patients.
Yeah, he talks about repeatedly failing to put in a central line, which is, pretty common procedure,
Yeah.
where a catheter is inserted into a large vein. And he describes the frustration, the patient's discomfort, and the supervising resident's kind of blunt teaching style.
It makes you wonder if there's a better way to train surgeons. You would think there would be more emphasis on simulations or something before they're let loose on actual humans.
Well, Gawande actually addresses that very question in the book. He discusses that ethical dilemma of balancing patient care with the need to train new surgeons. And he suggests solutions like graduated responsibility. So where new surgeons take on more complex cases as they gain experience and more structured learning opportunities.
But even with those safeguards in place, it sounds like those early procedures are still pretty nerve-wracking for the surgeon and potentially risky for the patient.
Absolutely. It raises important questions about informed consent. Do patients truly understand the risks involved, especially when they're being operated on by a surgeon who's still learning the ropes? And how much information is enough?
Makes you think twice about being the first patient a surgeon operates on. But I guess the flip side is that teaching hospitals in general tend to have better outcomes overall.
That's an interesting point. And Gawande does suggest that the constant presence of residents asking questions, double-checking things, creates an environment where everyone is a bit more vigilant. It's this continuous learning atmosphere that ultimately benefits patients.
And that learning curve never really ends, does it? Even experienced surgeons have to adapt to new technologies and procedures all the time.
Absolutely. Take the introduction of the pulse dye laser, for example. Surgeons were essentially relying on observation and limited simulations, with very little hands-on training before using it on patients.
And then there's this crazy story about the robotic surgery device. This almost $1 million robot with tiny arms and cameras. Surgeons were literally practicing on kidney stones and test tubes and trying not to puncture egg membranes before using this technology on actual humans.
Yeah, it highlights how medicine is constantly evolving. Surgeons need to be adaptable, embrace lifelong learning, and be comfortable with new technologies. But it also raises questions about how we evaluate the safety and effectiveness of these technologies before they become widely used.
It seems like there's always this tension between pushing the boundaries of what's possible and ensuring patient safety. And sometimes things do go wrong. Guande doesn't shy away from discussing medical errors, and he emphasizes that all doctors make mistakes.
That story about the emergency tracheostomy that went wrong is particularly gripping. He describes the chaotic scene, the patient's deteriorating condition, and his own feelings of shame and responsibility. It's a raw and honest account that reminds us that medicine is a human endeavor, and humans are fallible.
But he goes beyond just acknowledging individual errors. He explores this concept of latent errors in the system itself.
Yeah, this idea was developed by psychologist James Reason and suggests that errors are often the result of systemic issues rather than individual incompetence. So, for example, the design of equipment, heavy workloads, and communication breakdowns can all contribute to mistakes.
Like how different cardiac defibrillators have completely different designs, which can lead to errors when doctors switch between them, or how a simple prescription can go wrong because of memory lapses or misreading a handwritten order. These latent errors are like these hidden traps in the system.
Exactly. They're a reminder that we need to look beyond blaming individuals and focus on improving the system itself to prevent future errors. And Gawande provides a great example of how this can be done with the story of anesthesia safety.
He talks about Jeffrey Cooper, an engineer who applied aviation safety principles to anesthesiology.
Right, by analyzing errors, identifying systemic issues, and implementing solutions, like carbon dioxide detectors and pulse oximeters to monitor patients' breathing. Cooper helped dramatically reduce anesthesia-related deaths.
It's incredible how such seemingly simple innovations can have such a profound impact on patient safety. It shows that by taking a systematic approach to error prevention, even complex systems like healthcare can be made much safer.
And that leads us to another interesting aspect of Gawande's book, his take on surgical conventions. He compares them to public relations congresses questioning their true purpose and effectiveness.
He describes these lavish exhibit halls filled with expensive medical devices, live televised surgery demonstrations. It sounds more like a trade show than an educational event.
He even describes surgeons crowding around a turkey testing out a $15,000 harmonic scalpel. It's funny, but it also raises important questions about conflicts of interest and the influence of the medical device industry.
It makes you wonder, is all this new technology really benefiting patients, or is it more about profit and hype? And how do we as patients navigate this complex world of medical information and make informed decisions?
Those are excellent questions. And I think Gawande's point is that we need to be critical thinkers. Don't just accept everything you hear at face value. Do your research, ask questions, and consider whether new devices or procedures are truly necessary and beneficial.
And speaking of questioning, Gawande tackles another tough topic, identifying and dealing with incompetent physicians.
Yeah, he shares the story of Dr. Goodman, a skilled surgeon whose performance declined due to personal problems and an overwhelming workload. It highlights the ethical dilemma of balancing compassion for a struggling colleague with the responsibility to protect patients.
It also reveals how difficult it can be to address physician incompetence. There's often a reluctance to report concerns. And the system for dealing with these issues isn't always effective.
Gawande explores potential solutions like early intervention programs and confidential support systems for doctors who are struggling. It's a reminder that we need to create a culture that supports physician well-being and addresses problems before they escalate to the point of patient harm.
It's a complex issue, but it's one we can't afford to ignore. And speaking of complex issues, Gawande's exploration of chronic pain really challenges our assumptions.
He goes beyond the traditional gate control theory of pain, which suggests that pain signals are modulated in the spinal cord. He introduces the idea that pain is this complex experience generated by the brain, influenced by social and psychological factors as much as physical ones.
He shares the case of Roland Scott Quinlan, whose chronic back pain defied physical explanation. Traditional medical approaches failed to provide relief, and it became clear that social and psychological factors were playing a significant role in his experience of pain.
It's a reminder that we need to move beyond a purely biomedical model of pain and consider the whole person when treating chronic pain. The mind-body connection is powerful, and we're only beginning to understand its complexities.
And this leads us to this fascinating topic of the placebo effect. Gawande highlights studies where placebos outperformed real anesthetics, suggesting that the brain's influence on pain perception is far greater than we previously thought.
The dental procedure study is a great example. Patients who received a placebo and reassurance from the dentist experienced less pain than those who received real anesthetics without that reassurance. It's a reminder that the power of suggestion, the belief in a treatment's effectiveness, can have a profound impact on our experience.
It really makes you wonder how much of the effectiveness of any medical treatment is due to the placebo effect, and how can we harness that power ethically and effectively?
Those are important questions, and they highlight the need for more research in this area. The placebo effect has huge implications for pain management, and potentially for other conditions as well. And it also speaks to the importance of the patient-physician relationship, the power of trust and empathy in healing.
And then we have Gawande's exploration of nausea, an experience that's often overlooked but can be incredibly debilitating.
He examines the pervasive nature of nausea, from pregnancy sickness to chemotherapy-induced vomiting. He shares the story of Christine Fitzpatrick, a pregnant woman suffering from severe hyperemesis gravidarum, highlighting the limitations of medical treatment and the social and emotional toll of debilitating nausea.
What I found interesting was how he explores the biological purpose of nausea, its evolutionary roots, while also acknowledging the gaps in our understanding and the inadequacy of current treatments. It's a reminder that even common everyday experiences like nausea can be incredibly complex and challenging to manage.
And it underscores the need for more research to develop more effective treatments that address the suffering it causes.
Welcome back to our deep dive into Atul Gawande's complications. We just finished talking about the complexities of medical training errors and how medicine is constantly evolving. And I think we wanted to shift gears and talk about second opinions, which, it's always a good idea to get a second opinion, but Gawande really drives home just how crucial they can be.
Yeah, he shares this case where a second opinion quite literally saved a patient's life. It involves this woman named Eleanor Bratton, who came in with what appeared to be a routine case of cellulitis, a common skin infection.
But it turned out to be something much more serious, right?
Right, it turned out to be necrotizing fasciitis, the infamous flesh-eating bacteria.
Yeah, that sounds terrifying.
It is a very serious condition. and it can spread rapidly and be life-threatening if not treated quickly.
And what's so interesting is that Gawande, as the resident on the case, initially dismissed the possibility of necrotizing fasciitis. And he said it was because he'd recently had another case where things had gone terribly wrong. And that experience kind of biased his judgment.
So even doctors can fall prey to these cognitive biases, these mental shortcuts we all use to make sense of the world.
Absolutely. And in this case, it was the patient's father who insisted on a second opinion. And that fresh perspective from another doctor led to a more thorough evaluation, the correct diagnosis, and ultimately saved Eleanor's life.
It's a powerful reminder for patients to advocate for themselves. If you're ever unsure about a diagnosis or a treatment plan, don't hesitate to seek a second opinion, especially when the stakes are high.
It's a good reminder that doctors are human, and even the best doctors can miss things, make mistakes, or be influenced by their own experiences and biases. And a second opinion can provide valuable insights and potentially change the course of treatment.
Yeah, it's not necessarily about, not trusting your doctor. It's about having a system that encourages and normalizes the process of getting a second opinion.
Absolutely. And speaking of learning from mistakes, Gawande then takes us into the world of autopsies, and he laments their decline and argues for their continued importance in medicine.
He shares this story of Mr. Jolly, whose death seemed pretty straightforward at the time. But the autopsy revealed a major misdiagnosis. And it's a reminder that we don't always know what we think we know, and that autopsies can uncover crucial information that might otherwise be missed.
He even cites studies that show that autopsies reveal a major misdiagnosis in the cause of death in about 40% of cases, which is a pretty staggering figure, especially considering that the rates of misdiagnosis found in autopsy studies haven't really improved that much over time, even with all the advancements in medical technology.
So even with all our fancy scans and tests, we're still getting it wrong a significant percentage of the time.
Yeah, it's like this feedback loop that's been broken.
Exactly. Without that feedback, we're essentially making assumptions about the cause of death without always verifying those assumptions. It's like trying to perfect a recipe without ever tasting the final dish. You might think you're doing everything right, but you could be missing some key information that would make it even better.
And it's not just about identifying misdiagnoses. Autopsies can also reveal previously unknown conditions, uncover patterns of disease, and even lead to new medical discoveries.
Absolutely. They can help us understand how diseases progress, how different treatments affect the body, and how individual variations in anatomy or physiology can contribute to illness. It's a vast repository of knowledge that we're losing access to as autopsies become less common.
It's like we're becoming complacent thinking that we've got it all figured out with modern medicine, when in reality there's still so much we don't know. But this idea of medicine as a journey, not a destination, is a recurring theme in Gawande's book.
It is. He uses this wonderful analogy comparing humans to something between a hurricane and an ice cube. So in some respects, we're permanently mysterious.
Yeah.
But in others, with enough scientific exploration and careful probing, we can be understood.
I love that analogy. It really captures that essence of medicine, this constant tension between what we know and what we don't know. The drive to understand, to explore, to push the boundaries of knowledge, and at the same time, the humility to acknowledge that there will always be mysteries, complexities, and limitations in our understanding of the human body.
And it's that humility, that willingness to question and learn from mistakes,
Mm.
that is so essential to providing the best possible care for patients.
Welcome back to our deep dive into complications. So we've talked about the challenges of surgical training, the importance of second opinions, the declining rate of autopsies, and now we're getting into some of the most intriguing stuff, those medical mysteries that remind us just how much we still don't know.
Yeah, Gawande talks about these cases that just defy easy explanation, like the story of Marie No, this woman from Philadelphia. All 10 of her children died under mysterious circumstances.
Wow, all 10.
Yeah, one was stillborn, one died at the hospital, but the other 8 died at home as infants. And despite thorough investigations, including autopsies, there were just no clear answers.
Oh my gosh, that's just heartbreaking. Imagine the grief and the unanswered questions for the parents. And it just shows you the limits of what we know as doctors, even with all our technology and expertise.
Initially, they thought it was SID's, sudden infant death syndrome. But later investigations, they kind of raised questions about whether something else might have been going on. But ultimately, the case remains unsolved.
So it's like a real-life detective story, but with incredibly high stakes.
Exactly. And it just really underscores the need for humility in medicine. We have to acknowledge that there are limits to our knowledge. And sometimes, despite our best efforts, we may never fully understand what happened.
But that doesn't mean we should stop searching or stop questioning.
Of course not. It just means we have to be comfortable with uncertainty.
And sometimes those mysteries can lead to unexpected insights. Like Gawande also talks about this case involving a man who had all these falls and then developed incontinence. And at first it seemed like these were totally separate issues, but it turned out there was one underlying cause.
Right. He was eventually diagnosed with a spinal cord tumor that was compressing his spine. So this case shows how seemingly unrelated symptoms can actually be connected, and how even experienced doctors can be misled by initial impressions.
It's like a reminder to always consider all the possibilities, to think outside the box, and to keep an open mind when we're trying to figure out what's going on with a patient.
And it also shows the importance of really listening to the patient, taking their symptoms seriously, even when those symptoms don't fit neatly into a textbook definition. Sometimes it's the patient who notices subtle changes or connections that a doctor might miss.
It's about connecting the dots, looking for patterns, and recognizing that the human body is this incredibly complex and often unpredictable system.
Exactly. And that's where the art of medicine comes in. It's not just about following algorithms and guidelines. It's about the ability to synthesize information, to draw on experience and intuition, and to make judgments based on the individual patient's circumstances.
It's that combination of science and human connection that makes medicine so fascinating and so challenging.
Definitely. And I think that's what makes Gawande's book so compelling. It's not just a collection of medical stories or scientific facts. It's a reflection on what it means to be a doctor and a patient. It's about the uncertainties and complexities of medicine and the resilience of both patients and physicians in the face of those challenges.
So as we wrap up this deep dive into complications, what's the one thing you really want our listeners to take away from this?
I think the biggest takeaway is that medicine is a journey, not a destination. There will always be complications, uncertainties, and things we just don't know. But by embracing those challenges, by being open to new knowledge, by questioning our assumptions, and by never forgetting the human side of medicine, we can continue to learn to grow and to provide the best possible care.
And maybe, just maybe by understanding those complications, we can make medicine a little less imperfect.
Absolutely. So keep questioning, keep learning, and keep exploring the world of medicine.
This has been a great conversation. Thanks for joining us on this deep dive into complications.